how many or who's on? No.
I think we'll see. Hang on, let's see.
Okay.
Why have I quit my job? Why have I, bought a van? And why am I going to drive around the country? Well, I'm passionate about the idea that you need to be heard. And I want to stitch these stories together across the states. We're going to find the commonalities. And it's going to be really an amazing experience. And I look forward to you joining me on the jar.
Hey, good afternoon, everybody. Welcome back to Mental Health Today. I'm your host, Ken Stearns. Another great episode lined up. Having a super pre-chat with Joe Feldman, and he is the president of Cover My Mental Health. It's really interesting as I was doing a little peek at his profile before we started and realized, holy cow, he is living right now where I used to live as a kid for 20 years, growing up in the north side of Chicago, suburbia. One of the most idyllic places to be a child. One of the I'm like, the more I live and the longer I go, the more grateful I am for my parents and bringing me up in this sleepy little town of Wilmette. Just a great, safe, beautiful chunk of Americana back in the 60s and 70s. And probably a good reason why I would attribute my mental health as being pretty solid and having a good, strong base. And I was sharing with Joe before we started, I'm staying with a friend right now who also an old grade school buddy. Sorry. We've known each other since we were about 5 or 6. And we are both just commenting the other day how lucky we were to grow up in Wilmette and to live there. And, how fortunate we were to have the great parents we've got and such a great, solid foundation to start life with. And not everybody's got that kind of that foundation. Joe, thanks for being a guest. Thanks for the little pre-chat and everything else. And I'm excited. Yeah, I'm excited to really learn what you're doing because it seems like this is somewhere between a business and an insane passion. And I'm excited to kind of find out where it lands.
Well, it is certainly an insane passion, and I certainly am treating this as a new venture. I feel like the entrepreneurial roles that I've had through my career have in a way prepared me for this in a way that I can't say I had planned all along. That would not be quite true, but it turns out there's a lot to apply to this nonprofit startup as for other kind of startups. So good to be here.
It is interesting how life does. We always end up, we were talking before we started, right? You're just right where you belong. You're right where you belong with all the tools you need to make this a success, the experience and the tools.
Indeed. Absolutely.
Yeah. So tell us, what is Cover My Mental Health? How do people find out more about it? And what are you trying to accomplish?
Great. Well, Cover My Mental Health is an online resource that supports people at the point of crisis when their insurance company is standing in the way of their access to mental health care.
Okay.
So the idea is that sadly, there are too many denials of mental health care, too many challenges finding a provider in network. I've estimated that there are between 15 and 20 some million denials every year by private insurance companies of individuals, and somewhere north of 5 million individuals go out of network because they can't find a provider. And so people get discouraged and providers get discouraged.
Yeah.
And at some level, I'd say insurance companies have conditioned clinicians and patients both to give up and just say, you know what, I guess I'm not covered. And if you have the means to pay for it privately, then you might do so, but that's not right. You paid for insurance. That's what it's for. And if you're talking about more expensive care, it may be that you or a family member has to go without, which is also not right. Makes no sense. So that the whole idea is we provide, first and foremost, encouragement. You don't have to take no for an answer. And second, resources in the form of template letters you can download at our website, scripts that you can download that tell you the 5 things you should say to an insurance company. And the few things that you should not say.
Okay.
So that you can help yourself starting this afternoon.
That's really interesting. And how is this being funded? Are you bootstrapping this yourself?
So we launched the website about a month and a half ago. It's at www.covermymentalhealth.org.
Okay.
We have our IRS 501c3 designation. So contributions.
Congratulations.
Thank you.
That's not easy.
I'll tell you, I'm going to go with it was shockingly easy. We submitted the paperwork and we were told it would take 180 days, took 30. So we're good there. A provider of mental health services nearby called Compass Health. They're in Northbrook, Illinois.
Yeah.
About 15 minutes from here. They made a substantial seed investment to help us get going. And I've had a few contributions from friends and some clinicians. And we're in the process of applying for grants. And indeed, I'm bootstrapping the cost so far. At the moment, I'm the funder of last resort. Getting started has not been really that expensive. I've had a lot of help from literally dozens and dozens of experts in putting the materials together, getting advice on where to get a website built inexpensively overseas. And my goal is to get the site out there and get it in front of as many people as possible. And I firmly believe that the funding will come. And and so far so good.
I mean, I have a long-standing theory that the universe hates an imbalance, and if you tilt the scales in value and you're providing something of value, and you're putting it out there and you're helping people and you're doing great work with good intentions, you'll be fine.
I think that's right. I mean, I think of it as there are going to be foundations and philanthropists who for some reason understand that mental health is a huge issue and a challenge, and we're offering a set of resources and I'd say an approach that no one else is offering.
Yeah.
And so I think there'll be funding from, call it those, more wealthy individuals. I think clinicians will be supportive over time.
Yes.
I think of that as someone has to pay for the lighthouse, so everybody can take advantage of this resource that helps clinicians, and some will choose to use it, which is great. And they might promote it on their website, which is good.
Right.
And others may support us. We have a donate button on the website, and I expect that there'll be some individuals who say, gee, that really helped me to, there was a resource I downloaded. It made a big difference. I'm going to send in $25.
Yeah.
I'm going to send in,
excuse
me, some other number.
I'm
let's say this. I'm just generally not really worried about that. So
Yeah,
it'll come. Not to discourage people making contributions. They're certainly welcome.
Yeah. Well, I mean, if you don't have a lot of overhead right now, then the kind of slow growth is okay. I spoke to so many clinicians. Last year I've did about 100 interviews last year, 120 last year, and I don't know how many were clinicians in the beginning. Quite a lot, or people in the billing area, administrative side, and just how many clinicians said, "Yeah, I don't work with insurance companies."
Right.
It's too painful. I need two people to bill to absolutely fight the insurance companies to get approval, to get paid, et cetera. And she's like, it's not worth the hassle. I have enough clients that are willing to pay. So the insurance companies have created this crazy outcome from this.
Right. It's a big challenge, and there've been some really interesting studies published by organizations like RTI and Inseparable and the Kaiser Family Foundation about how insurers underpay mental health professionals and create other disincentives for them to join the network. Because if you can run your practice and not deal with someone who's slow to pay, questioning your judgment, clawing back a payment that they made for a reason that you just don't understand, or withholding payment, why would you do that? And the answer is really that they can. And I mean, I think the good news is that there are more and more regulators and legislators that are working to um, stop that. And I've had the opportunity to testify in front of the Illinois State House and to interact with state and federal legislators and regulators. At the end of the day, I'm just too impatient to have that be my only area of advocacy. And that's really what Cover My Mental Health is about. I'm too impatient. And so while we're waiting for the world to get a little better, I want to try to find a way for people to have resources they can put to use again this afternoon to push back on the denials and blockades.
Necessity is the mother of all invention, right? Like, or dreaming, somewhere in there, but you definitely, impatience is the other mother of invention.
Right. Yeah. People have, I think it's, again, we're conditioned to accept no for an answer. And
Agreed.
And I was talking with one of my closest advisors just this week about how if you look in your health insurance policy, the really big one, the one that's 300 pages long, not the little summary that you might get from your enrollment period, but in the hundreds of pages, it'll describe what to do if you don't like a decision they made. You can file an appeal.
Okay.
And that's true. You can. It's a legal process. They don't describe the consequence of it. They don't describe how seriously it has to be taken, and it doesn't really address that it's going to take a long time, and you're not going to be satisfied with the result. More often than not, you'll get a note back, "We decline your appeal." What do you do with that?
Even better. Yeah.
What do you do with that?
Yeah.
So we provide. I think it's 8 different steps that you can take that you don't have to become an expert, but that you can take to push back on a denial or a blockade to care before you even think about an appeal. And that's something that insurance companies don't share with you because they're not obliged to, and it's really not in their interest to tell you about that.
How does one end up in your shoes?
Well, so our by accident is the short version. Our daughter.
I love that. In a good way or a bad way? We're going to find out.
Well, it's I would say it wasn't my choice, but back when our daughter was in high school, she had some significant challenges, and my wife and I, I'll say, did a lot of work and with a lot of experts to try to figure out what care would be appropriate for her, and we made sure she got that care, and she's in the meantime doing fine. She's, I'll say, got the challenges of a young adult and not like she had in high school. And our insurance company said, well, we're not paying for that. And that was a little bit of a surprise. A friend of mine who had worked in and around health insurance for a lot of his career met me for breakfast at Walker Brothers, just down the street from where you grew up and where I live. And we were sitting having a pancake breakfast. And I told him that we had just organized our daughter to get this care, and it involved a residential program. And he said, by the way, your insurance company is going to be really a problem on this. And I said, I didn't even think about that. I've just been so focused on getting her the care she needs. And so that was really the tip off. And so they said, we're not paying for it. And we sued them in federal court and won. And so through that adventure, and all the preparation for that lawsuit, including gathering information, every phone call with the insurance company, I took meticulous notes. We filed appeals with someone who's really expert in appeals that might end up in litigation, which is really the way they all should be filed. And it was not an expensive resource, not free, but someone who's really savvy in that matter. And the appeal was declined. Just as I described it. No, we're not going to accept your appeal. And there were enough of the right characteristics that we were able to be successful and get a judgment. And then they paid what they should have paid. But 3 years later, right? So
for them, probably you're one of 1,000. You're one of 10,000. and it's worth it. They fought you and they paid you what they were supposed to pay you, and then 999, other people got nothing.
Exactly right. I call it we will wait you out strategy. So
Brutal.
They will wait you out, and they have. It's a challenging situation for a consumer, for a patient, because there are certainly laws that are supportive of patients having access to mental health care. The Mental Health Parity and Addiction Equity Act, called MPEA, is one of the most significant. It's been around for about 15 years. New regulations are going to be issued this year at some point. And it'll get better. Insurance companies just are not penalized much for delaying or dragging their feet or withholding information. And so I think it's important to work at the legislative and the regulatory level to advocate for a system that's robust and holds insurers to account. But again, going back to my impatience, while we're waiting, there are tools that are available on our website and recommendations of where you can get help that people can take advantage of today while they're waiting for the laws to be properly enforced.
Yeah, one side note I was an insurance guy for a long time, 35 years, 30-ish years. And several of those years in different roles, I oversaw claims in some capacity. These are life claims, accident claims, disability stuff that happened on policies. We are a life company, but we had a lot of health riders. And so I saw all the claims that were appealed. Like every appeal came to me over a certain dollar amount. And then definitely any claim that was longer than 90 days, we had different things, and this is in Asia. These are international companies, but we're operating at an international standard.
Right.
And our job is to pay, our job is to pay a claim, to find a way, when it gets to that level, it's like, how do we pay this? Give us, that would be the question to the people is why are we not paying this? Okay. Unless there's real fraud, unless it's fraud, it's a different story. Then we push it back to the investigators. But if there's no fraud, it's help us find a way in the rule to pay. So to think insurance companies are literally going around and the message is clear. It's how do we not pay, or delay this? Because that's a strategy or it's not.
Right.
You don't accidentally end up in a place where you're denying, I don't know how many claims, and you're finding ways not to pay. So to me, it's abhorrent. The insurance company, your job is to pay claims, to be there when people need you. This is terrible method. Tell her practice, whoever, this kind of practice, terrible.
Yeah. It's, at some level, it's just inexplicable. A friend of mine worked for
inexplicable.
For I think 3 different health insurance companies, and he ran the behavioral health unit of these different companies.
Yeah.
And he told me that when the denial rates creeped up, that their profits went down because they were not paying for the preventative care and the early intervention care.
Yeah.
And when you only pay for the more complex advanced care, by the way, both on the physical side and on the mental health side,
yes,
you end up worse off.
Same.
And he said, I would press my colleagues to not deny these claims, just, I'll say, gratuitously.
Yeah.
And he said, when we stopped that, we made more money. And most importantly, we were providing the health care that is our job.
We were actually doing our job the right way. And
yeah, it's crazy. You hear talk about fraud in the mental health care space. And I can certainly imagine, as with any commercial activity, there's going to be some amount of fraud. So,
it's there.
It's there, and reducing it to zero is not possible, and it's too expensive, and that's not good. The amount of fraud we're talking about, by any research that I've learned of, I haven't done any myself.
Okay.
It's de minimis. And insurance companies, I think the more likely narrative that you would hear is Well, we're not trying to stand in the way of care. We just want to make sure that it's medically necessary. That's the key phrase. And so an insurance company would say, we pay for all medically necessary care under mental health and substance use disorder. And it's those words that'll show up in the insurance policy. And so when insurance healthcare claim comes in and the denial is not medically necessary, that's the insurance company making their own judgment.
Sounds like an opinion.
Compared to a psychiatrist, a psychologist, a therapist who has actual access to and responsibility for the patient.
Yes. Different.
That's one of the big, I would say, the most significant resources on our website, which is covermymentalhealth.org. And it's a template letter, a medical necessity letter.
Okay.
It's in Word. So a clinician can download or be given a download of this template. It has very easy, straightforward instructions. It's been developed with input from clinicians and from experts in overcoming claims, either by appeals or litigation. We're not trying to offer in any way legal advice. What we are trying to offer is guidance about how a clinician can communicate their decision about what's medically necessary. So they might say, I'm Dr. Feldman, which I'm not a doctor, but I'm Dr. Feldman. I studied at the University of wherever. I practice in this particular area. I've been working with patient Ken for X period of time, and he presents with such and such a condition, and using the standards of, and then naming the specific standards that are generally accepted by clinicians of that type. This is my assessment based on those criterion. And this is my determination about the care that's medically necessary. Signed, Dr. Feldman.
Mm.
And that's really important because you could say it at the beginning of care, it puts a marker down to say, I'm the clinician, I'm the one who's making the medical necessity determination here. And it puts the onus on the insurance company, not just to consider the claim, which they should, but it gives them the information about what's medically necessary based on the person who knows best.
Yes.
And to the extent that the insurance company wants to say, we don't think that's really medically necessary, now they have to, I'll say from a practical standpoint, they have to come up with a better reason than whatever the clinician put down.
Yeah.
So it doesn't mean that they're just going to say, oh, okay, sorry about that, we'll just pay this claim. But the onus is now on them to explain why the clinician got it wrong. Right. So that's a really significant tool.
That's powerful.
It can also be that a denial comes through not medically necessary, that the clinician can provide a medical necessity letter at that time to say all the key points that I mentioned, who they are, what their training is, what their determination is based on, and what they've decided is medically necessary. And here's why the denial is wrong.
Mm.
Here's why the denial is wrong. And that information is crucial for any escalation at all.
Yeah.
That might come about for someone who's trying to get the care that they or the family member needs.
That might be the whole value of the website right there. Like after anything after that's bonus.
Well, it's so I think we have one other area that is, I think, really significant. But medical necessity is a big deal.
Yeah, that's to me a very powerful tool.
Yeah. The other problem, or let's say the other obstacle that is really common, is individuals that can't find a provider in their network.
Yes.
So we know that insurance networks are small for the reasons, Ken, that you articulated earlier. And, and so we provide on the website, again, a tool that you can use starting this afternoon. The first tool is a worksheet that you can download in Word. It's ready to go to essentially show your work. So if you're going to say to your insurance company, by the way, I can't find a provider in my network, it's not unreasonable for them to say, did you try? And the answer is, yes, I did. And then you've got a worksheet that gives you the ability to keep score at home. I called the following therapists at the numbers that were provided in the online directory or that a customer service rep gave me, and here's the result. Didn't answer the phone, offered me an appointment a year from November, isn't taking new patients, doesn't actually practice what I thought they practiced, and therefore they're not relevant to me or my family member. To then be able to say, yes, I did my homework, and there's not a provider in my network. So either A, find me an appointment, or B, pay for my care out of network at an in-network cost to me.
At an in-network cost, right?
And that's an area of increasing success with appeals and with complaints to insurers. It's one of the experts who I've worked very closely with in this area calls it in for out. So you're getting an in-network rate for an out-of-network appointment. And if the insurance company's service is to provide you with care, they need to provide you with caregivers. And if they can't do that, then empowering an individual to do more than just say, can't find a provider in my network, or I guess I'm going to have to go out of network and, or I guess I'm going to have to go without care. It's just not right.
Yeah, no, that's that's not acceptable, especially like you said, if you've got insurance and that'll help insurance companies focus on expanding their networks. That kind of advocacy and consumer action will help the insurance companies focus on what they're supposed to do, which is provide a good network. Even though, also painful for the insurance companies, there's not enough therapists.
Well, there's not enough therapists in network.
Yeah, or just even the totality of therapists in the country and the amount of people that need care,
right,
I think is still doesn't add up.
Right. Now, there's definitely I'll say a workforce imbalance.
Yeah,
no doubt about that. And that needs to change over time. And there are many ways to incent folks to enter these professions. And one of them is pay fairly and trust the expertise that they've built and are building.
Yeah. And I think post-COVID, I had one of my guests on was somebody that's in the business of recruiting therapists and helping them move around, kind of a recruiter / headhunter person, and also an advocate for the industry, trying to get more people in, because more people come in, this person can place more people and, generate more fees for their business. And this gentleman really was saying, it before COVID, this was a shockingly low paid job. Like really shocking, like dental hygiene, this level, not up to a standard of a doctor or, somebody, a clinician that's gone through the programs. And he said, it's opened up the fees have gone great growth. People are way, way closer to fairly paid, although still not. And he said, the growth, the fee growth is going to happen still. So the fees seem to be getting better. It's a career that people now are at least can look at and realize that studying for it is worth the effort, and they can help people.
Yeah, I think that's right. Yeah, from having interacted with mental health professionals and advocates, my headline is, this is an all of the above challenge. So there are lots of different ways to approach improvement in overall access to care and capacity to help people, and research for medications and different treatment modalities. All this work has to get done. And we feel like Cover My Mental Health can play an important part and really filling a gap in the market. I mean, there are certainly different resources that are available to help people deal with insurance obstacles. And what I've learned from my market research and talking to stakeholders is that before Cover My Mental Health, there really hasn't been one that provides the comprehensive, actionable resources that we do.
Yes.
And And so that's been not just encouraging, but it's also made our offerings better as we've been out talking to folks and learning more and more ideas about how individuals can overcome obstacles. And I think I know more than the average bear about this, and I continue to learn new things, new approaches, and new strategies that over time I'll be able to bring and provide that really anyone who is motivated can take on without having to become an expert. So step by step, we'll get better and better.
Yeah, I like this idea that you are. I think it's a good description, really. If you fall out, I mean, if you fall into the cracks in the system, it's a straight shot to no, and it's this monolithic, ginormous insurance company that tells you no, and they've got really great language, and they have endless form letters and endless attorneys. So where do you fall? You just, like you said, you just fall either don't get the care or you pay out of your pocket, etc. So to have a little safety net, and now the question is how to make sure people can land in it,
right?
And how to get the message out. So that's what I was having some back thoughts here, about through what associations, like how do you get in, like how come every clinician doesn't know about you, every clinic, like how does that happen?
Right. So we're relatively new. We launched in you
got to move faster, Joe.
So I'm that's how I feel about it.
I'm sure. Well, already, because you started your own company because the machine's not moving fast enough.
Yeah, we incorporated in January, and the website launched about a month and a half ago.
Awesome.
So we are focused on talking to clinicians,
okay,
whether hospital level behavioral health operations or specialty clinics, or advocacy groups that can help us to reach clinicians that are in this space. And my vision for Cover My Mental Health is that clinicians will have reference to this resource on their website, on their patient portal, at the bottom of their invoices. That advocacy groups, whether national level groups or more regional or maybe disease or specialty, so parent support groups, will have us show up in their resources or on their newsletters or with webinars. So since we launched, I've had the opportunity to, for example, host a workshop that was hosted by the Chicago School, used to be the Chicago School of Professional Psychology.
Okay.
I'll be speaking to a group called Other Parents Like Me on August 1st. So that's an organization that supports parents of kids who are primarily in residential treatment. I'm talking with a couple of the NAMI affiliates about participating in their annual meetings. I've been invited to speak at the Mental Health America national meeting in September in Washington. The Illinois Association of Behavioral Health is going to host a continuing education accredited workshop online in October. These are all, I'll say, steps to getting the word out.
Yes.
And
great.
And trying to take advantage of, at some level, a network effect.
Yes.
I can't, at some point we'll learn more about which of these approaches work, where there can be sort of a train the trainer sort of approach. So it's we're definitely in a learning phase. I've been really lucky to work not just with Compass Health, but with Austin Riggs Center in Western Massachusetts, and I'm starting to work with Silver Hill Hospital in Connecticut. These are two leading psychiatric facilities that are very involved and engaged in insurance-related challenges. So it's really a pleasure to to work with people who have a different experience and a professional expertise that that I can collaborate with, and the feedback that I get is that they look at some of the tools that we're offering and say this is directionally what we've been trying to get after But meanwhile, we're trying to take care of our patients. So we're,
Yeah.
we haven't, we haven't invested necessarily in that either. So it's good.
Well, and and that's where the funding will come from. You just need one of these guys to say, yeah, let's put some money in here. Let's do some advertising. Let's find a way to get the message out.
Absolutely.
Stronger.
Absolutely. No, it's been, I've talked to the CEOs or leaders of about, I'd say 8 of the national advocacy organizations. And the level of support has just been fantastic. It's really been great. I'll say, take my hat off to Patrick Kennedy. I've been collaborating with him on policy matters related to mental health. He's certainly a leader, maybe the leader in this area. And, he's been super helpful in every way that you would want with introductions and connections and other support. It's really, it's just really helpful to know this is a gap in the market, so to speak, that we can fill, and we just got to get busy.
Yeah, and I love that. This total safety net. People fall through the cracks, or sometimes pushed into the crack.
Right.
And it's good to know that like you're there, and they've got the tools right. Like I love what you say about literally you could start right now. You could have a letter done today. That's when you're in a crisis, you really don't want to learn about the history of health insurance. What you want is help today. Yeah.
You want to know, who can I call and what do I say to them so that I can take a step. And I should say, I think clinicians can help a lot.
I think a lot. They're the pointy end of the stick right now.
Yeah. For them, for clinicians. So a friend of mine needed some treatment, and their psychiatrist said to them, good luck with insurance. And they were telling me this, and I said, okay, that's not about luck. You have a contract. And so,
it's a good point.
And so, not that you're going to go argue contract law, but you're going to argue, I bought health insurance. This is medically necessary. You, my clinician, are the person who decides what's medically necessary. And by using a template letter that is really not that complicated, and the second one is for sure easy enough after you put down where you got educated and what your practice is, to say, this is what I do. This is my expertise. Yeah. Here's a letter, and away we go. Submit this to your insurance company. I say that should be standard of care for insurance anxiety, is a medical necessity letter.
Almost works in every medical case,
that is true.
Any kind of operation or procedure you might need, it's not a bad thing to have.
Yeah. Denials around mental health and substance use disorder are I'll say more challenging. But it's
physically, you can't see a report, right? You can't see the blood pressure. You can't see the blockage. It's all, it's all in the head, and it's hard to peel that open without causing some damage. And even then, I'm not sure you can look under the hood and see anything.
Yeah. I mean, I think there's an increasing recognition that mental health is health, and let's not make it any more complicated than that. And let's work together to get after it, because we're going to be a more healthy community if we take care of one another. And this is one way we take care of one another, is have people get the health care they need, remove as much of the stigma to asking for help and for seeking out help as we possibly can. That's a gift that we can all give.
Absolutely. And I'm 100% in agreement with this idea that, the mental health, if you don't take care of the mental health issues, they show up physically. So it boggles my mind that insurance companies haven't figured out that. Why don't you spend, just shift 20% of your treatment money to prevention.
Yep.
Move all that into mental health. Help people out mentally. And guess what? Heart attacks go down. Depression goes down. Anxiety goes down. You don't have all these SSIs being, prescribed. If insurance companies put 20% of their effort into prevention and education, we would kill the crisis. The mental health crisis in America would become just a regular thing that happens to people, and everybody talks about it, and everybody has their moments, and we all kind of rally around people instead of people hiding the shadows.
It's as simple as that. Let's treat mental health as health. Let's encourage people to ask for the care they need and to have tools to push back where the insurance companies didn't get it right. And I think Cover My Mental Health can make a more than small difference here. I think we can really have a big impact. So we're super encouraged by the progress we've made in a short amount of time. And we want to just, continue to get the word out to, work with providers and advocates to have links on websites and the like. I'm super delighted to participate in this, in this podcast as part of this, this effort to help more people. Because if we can help one person, then we've accomplished a lot for today.
People get close to us. I've had a guest on this show take his own life after about 2 months after the episode. So you just don't know what's in people's heads, and kind of normalize it, for God's sakes. Even somebody on the show ends up in a weak moment,
right,
desperation moment.
Yeah, it's a good friend of mine said, we know better and we can do better.
We can do a lot better. Joe, awesome conversation. It's great stuff. Like I said, holy cow, can't believe I've been around since January. I feel like I better get myself going faster. I better start running harder and faster.
There you go.
You guys have really done a lot, and very much appreciated. And it lines up with one of the biggest issues I think we've had on the show. It's just people finding care at a reasonable price, at a reasonable location, at a reasonable time, and getting access. And that's also one of the things we've talked about on this, as far as the mantra for mental health today is help with access.
Great. Thanks so much for hosting and for helping to spread the word, and just for all the work that you're doing by, keeping this conversation going. It's really crucial.
Yeah, it's killer. It's great. Thanks again, Joe. Thanks for being a guest. Thanks for sharing everything. And I think it'd be great to get you, let's make a mental note. Let's get you back on towards the end of the year or January and just see, the kind of crazy progress you're going to have by then.
That sounds great. Thanks a lot.
I really love it. Thanks everybody for listening and supporting Joe, and stick around for 30 seconds. In a couple of minutes, we'll chat afterwards. Thanks everybody for listening and supporting Mental Health Today. Jump down if you're listening on the audio version. Give us a rating, give us some stars, love some comments, especially the kind of stuff that Joe's working on there. Tell us your mental health story around billing. That'd be interesting to see kind of crazy stories we'll get on YouTube. This is that's where our best comments come on YouTube, and the best views and impressions come on LinkedIn as people kind of scroll past. So just take a moment to drop down and let us know you're watching. Hang on, Joe, and I'll see you in 30 seconds.
Very good. Thanks.
Yeah, loose, baby.
We're about to go and make this vessel with these great professionals at Public Glass. We're not part of the community, but we're from the outer family of glass blowing. Yeah, we're going to go make a magical giant jar with optic lenses so that if you turn it, it changes all the time. So if you change the way you look at things, the things you look at will change.
Eye to eye with the man